how about we begin today's program entitled Addressing Social Constructs to Improve Adolescent Health. My name is Sandeep Pathala, and I'm a program associate with the Environmental Change and Security Program here at the Woodrow Wilson International Center for Scholars. Our program is 18 years old, and we look at the various connections between health, environment, livelihoods, population, and security. Today's event is brought to you today as part of our HELPS project, and HELPS ironically stands for Health, Environment, Livelihood, Population, and Security, which is a 5-year initiative generously funded by USAID's Office for Population and Reproductive Health. And I see a lot of familiar faces in the crowd, so I think many of you know that the Wilson Center is a formal memorial to our 28th president, who was thus far the only president to achieve a PhD. And here at the center, we aim to bring the worlds of policy, practice, and academia together to gain a better understanding of how to inform each other. You have our speakers' bios in front of you, so I want to direct your attention now to the three of them. We have Margaret Greene, who's the director of Greeneworks. We have Denise Dunning, who's a program director of Adolescent Girls Advocacy and Leadership Initiative at the Public Health Institute, joining us from California. Jennifer Pope, who's the director of, the deputy director of Sexual and Reproductive Health and TB at Population Services International. And I just wanted to give a quick note about today's meeting. It's being webcasted live, so what that means is when it comes to the discussion portion of today's event, I'd ask for you to use a mic, and my colleagues will be on the two sides of the room and will be coming around if you have a question. And we please do ask you to use them so that folks who are tuning in are able to hear your great questions. So without further ado, I do want to turn it over, and we're going to have Margaret get us started, then we'll move on to Denise and Jennifer. Thank you so much.
Good afternoon to all of you who are here and to all of you who are watching on the web. It's wonderful to have such a big audience, and I think I think the title of the panel this afternoon is quite abstract, but I think we'll have a lot of very specific things to say. I wanted to start by just describing a scene that I recently saw that has really been gnawing at me. I just spent several weeks in Ethiopia, and upon my departure was at the airport and saw a group of about 70 or 80 girls between the ages of 13 and 20, all grouped together in one side of the airport and, chatting among themselves, holding their possessions, which seemed to amount to, a volume of about this big in a plastic bag or a small suitcase. And they were all waiting to board flights to Riyadh and Jeddah and some other locations as well. And I've just found myself so disturbed, because what you're seeing there is the girls, I think, have lots of different feelings about where they're going. They may have dreams about their economic prospects and the things they can do, away from home and away from the limitations of their communities. But what brings them there is a system of incentives that are participated in by adults, and a lack of information among both girls and parents about what the consequences of participating in that system might be. And I think part of what was so disturbing to me was that it's such a public reality. They're in an airport. They have to have travel documents. They're registered. The government knows about it. The airlines know about it. All the development professionals zooming in and out of Ethiopia are watching it and know about it. And what can we do? It's just such a gigantic problem. And so I guess what the reason that I've been thinking about it a lot, in addition to other things, is that contrast between what is going on in the girls' heads and sort of the excited talking amongst themselves and anticipation and so on, and what perhaps many of us know is waiting for them, and the system of relationships that has structured their departure in that way. So I guess another thing that it's just been, again, I just tried to make the transition to my assignment this afternoon, and I'm thinking a lot about how the world has made quite a lot of progress in acknowledging and to some extent beginning to address gender inequalities and understanding the ways that gender and discrimination related to gender impede the lives of girls and women. But it's made a lot less progress in understanding age inequality and discrimination according to age, which we completely naturalize now, for the most part, much as we used to naturalize gender inequality. And so although our panel today is really focusing on adolescents generally, and despite my personal commitment to working with both boys and girls, I'm really going to focus on girls in my remarks this afternoon, because they are at that intersection of the somewhat explored gender inequality and really unexplored and unquestioned age inequality. And the negative social construct that I want to focus on today is pretty comprehensive, and it's the way that we see girls as beneficiaries and recipients of our program rather than as capable actors and decision makers in our own lives, and how that and how so many of our programs fail to give them the skills and the knowledge that will make them more capable actors and decision makers in our lives. And so my basic message is we have to listen much more to girls if we want to make a difference in their lives, and because of the circumstances that girls face, it can be challenging even to listen to them at times. So oh dear.
I called upon your IT expertise while you were running down the hall.
Thank you. Great. Good. And then I just push that.
Yep.
Okay. Great. Thank you. So my presentation today is focusing on why, from the perspective of health and development programs, we should be listening more to girls, what girls are saying they want and need, and then 5 action points for addressing the needs of girls, which ultimately increases their access to service, but I think also accomplishes way more than that. Girls' voices are so powerful, first because of their combination of fundamental logic and their emotional appeal. Forget the way that we talk about the needs of girls and what we can offer them and what we can't in research and program documents and so on. Girls are very blunt. They speak with total clarity about the deprivations that they face and the obstacles that they have to overcome in everyday life to do the things that they want to do. Girls also speak with moral authority. Their perspectives really lay to rest all of the arguments that are so often invoked when we want to do something for girls about not interfering with culture. Because girls are members of societies, they are carriers of culture, and they are saying that they do not like certain things that they experience and that they need other things. And as a group, they're systematically given short shrift in their societies and their cultures. And they're speaking the truth when they when they say something about their lives. I think you are all very well aware of the roles that adolescent girls in poor countries play in their families and communities, really pivotal but often hidden. They often have no say in major life decisions that affect them, and their family and community norms often harm their well-being, yet they are bearing the burden of chores in the household, cleaning, fetching water, firewood, caring for family members, often working in fields or in family business as well. But their labor is ultimately denying them opportunities like education to fulfill their true potential. And providing all of these services to their families comes at a huge cost to girls. And perhaps, I think it's quite easy to make the argument, it's at a cost to girls and to their families, communities, and countries. And we know a lot more now than we did 10 or 20 years ago about what those costs are. Girls certainly understand very acutely the obstacles that bar them from opportunities, and they have very clear ideas about what needs to change in their lives in order for them to succeed. Listening to girls and their aspirations, what is it they want and how do they think they can get there, is an obvious but overlooked starting point for addressing the challenges that girls face. And why should we listen? What difference will it make to listen to girls? First of all, when girls describe the barriers that stand in their way, those descriptions help point to what needs to happen on their behalf and what those interventions need to be. Girls often can't change their lives on their own, and in order to change their lives, we have to find ways to open the minds of those around them by encouraging people to listen to what girls have to say and to respond to the conditions that they face. Girls' voices also confirm what the growing body of research about them proves, that investing in their education, health, economic opportunities, delaying marriage and childbearing can lead to long-term change for themselves and their families. And of course, it's our concern with health that brings us together this afternoon. A third reason it makes a difference to listen to girls is that girls' voices can demonstrate to policymakers and program managers that girls have the self-determination required to lead better lives. And again, it's so, I think the ideas about girls' limitations are so fundamental and they're so taken for granted that actually hearing from girls about wanting something different and seeing the pathway to achieving that is an enormously important advocacy tool. So what are some of the things that girls say they want? I think these will be familiar to you. First, they say, we want to delay marriage and childbirth so we can continue our schooling. And I think it's important to note that ending early marriage is not an idea only that's something that's coming from the outside, as religious leaders in Yemen and elsewhere have argued. Most of the educated elite families in even the poorest countries have abandoned child marriage. And so that tells you something about a sort of cultural ownership of the concept of delaying marriage. And of course, girls have lots of ideas about how to reassure their parents that they will marry, but should for now maintain access to schooling and their peer groups. Girls also point out that they need nutritious food and access to basic health services and information. And I think we're often, with very good intentions, very heavily focused on reproductive health services. And of course, girls need much more than that. In poor countries, they're often hungry and they have no exposure to the health system after the childhood immunization period is over. And a project that I wanted to call to your attention is being implemented in Rwanda by the Girl Hub, which is funded by Nike Foundation and DFID. And it's testing out the idea that it makes sense to bring girls in at age 12 for a sort of healthy checkup, bring them into contact with the health services, and before other things might happen in their lives, to provide them with the kind of information and access to services that will come in handy later on. So not responding to a crisis, but a healthy check-in. And girls say, we want control over our sexual lives, including when we have children and how many we have. They're often uninformed about sex and reproduction and exposed to sexual violence, and are often desperate to prevent their lives from being derailed by unintended pregnancy. So they're disproportionately exposed to risks of unsafe abortion, STIs, and HIV, and they're vulnerable to being expelled from school. And then, of course, even within marriage, they're often under pressure to demonstrate their fertility. And girls say, we want to be free from sexual violence, to walk freely in our communities, and to use public spaces as others do. And I think this is a really important point, that in general, girls do not have access to the things that by rights belong to the community, public goods from which girls are often excluded, things that may be taken for granted by others in the community, the ability to walk to existing services, the ability to play in a park, etc. Girls say, we want to be educated about how to avoid and combat HIV/AIDS despite the many pressures we face in our communities and schools. And of course, this information should be imparted as a component in a larger package of information and skills rather than being shared too narrowly, too little, too late. Girls say we want access to paid work and to be relieved of some of our chores. It's hard to know where to start with the issue of domestic labor and the negative effects that it has on the lives of girls. And of course, this is an issue that needs to be taken up not only with girls' families, but also in discussions of infrastructure, the placement of roads and wells, discussion of school attendance rules and the exceptions that are made for girls and the explanations that are given for their absences that differ from boys, and in community conversations about the use of resources such as animals or other kinds of vehicles for accomplishing some of those tasks for which girls are now are often the beasts of burden. So given what girls say about the broad constraints to their health and well-being, what can we do, or what should we do differently with this information? First, just making a systematic effort to listen to girls, to learn about their hopes, their plans, engage them in decision-making processes, which is really fundamental to changing the way that we think about girls. They're not only beneficiaries, they're opinionated. They know how to navigate their circumstances. They often know how. They know how to anticipate some kinds of resistance that they've encountered before, and they will have ideas about how to address some of the challenges that they face. The second point is how important it is to engage families, teachers, and traditional leaders as champions for girls. And we're going to hear from Denise Dunning about efforts to overcome community resistance to empowering girls. And there's so much more that can be done also to find additional ways of recruiting allies for girls, recruiting community members to support girls in new ways. Of special interest to me is any work to change male gender norms, what it means to be a man, and the kind of strength that it takes to stand up to certain kinds of gender norms and to advocate on behalf of girls, whether they're the girls in one's family or in one's community. And a program that I wanted to mention is a program of the Population Council in Ethiopia, which is doing really wonderful work through community conversations with husbands and wives about the challenges that they face at the community level and how somewhat, slightly altering their attitudes and behaviors, they can work collaboratively to address these difficulties that they face and improve their lives at a communal level. Others have also made this third point that I want to make, which is the need to provide safe and inclusive community spaces where girls can develop and speak up and raise their voices. And in settings as diverse as Brazil and Bangladesh, programs have addressed the needs of girls obliquely, sort of from the side, by creating spaces that reassure families about girls' safety and well-being and act as incubators for other kinds of things to happen. And one of my really favorite stories is about a group of middle school girls in Bangladesh who wanted to attend the secondary school in the next village but were not permitted by their parents. And the girls got into small groups, and they went from house to house to speak to each set of parents, and they told them that so-and-so thought it was all right if they went to the school in the neighboring village as long as they went together in groups. And so slowly they built consensus starting from zero. They by indicating to the first families that they spoke to that there was a developing agreement that girls could go together safely, they built that. And these are girls who were who got this bright idea from being able to spend time together and realizing that they all shared the desire to attend the secondary school, and all of them faced the same obstacle in doing so. Now, don't these girls look like they have some ideas to share with us? Or maybe they'd like to set us straight on a thing or two. They are alumni of Binti Pamoja in the Kibera community of Nairobi, Kenya, a program that includes so many different elements of skill building, information, and so on, different program elements that girls have called for. And now these girls, having gone through the program, are leaders for other girls, and they're leaders in the community as well. They're able to speak for themselves and on behalf of of others, and their confidence is really palpable. And finally, it's essential to change social norms that stifle girls' voices. And of course, this is a very hard thing to do, and it relates to everything else we might want to do on behalf of girls. I'm very glad to see Tostan colleagues here, because I know that they have a lot to say on this topic. So because these discriminatory norms exist, it's not enough simply to provide information and services to girls. We have to find a way for programs to take on the responsibility of working with girls to chip away at the set of beliefs and practices that keep them silent, unseen, and limit their access to these resources that exist, that are available sometimes, that are often available for others. And an example here of an effort to change social norms, a relatively new example, is a curriculum called Promises that Save the Children has just developed in Nepal. And it's very interesting. It's totally positive, and it's basically using emotional messages from parents and from girls about the benefits of allowing girls to delay marriage and stay in school longer. And these messages are posted around the community in sequence and in dialogue with community leaders and so on. I mean, I'm kind of describing it in very rough terms, but it's quite a precise set of activities and messages and so on. And then as a consequence of the buildup of the messages and the discussions that are had at the community level, everybody is supported in shifting at once, because that's the thing about social norms. If you think that somebody else isn't, then it makes it ever so much more difficult for you to change your idea about whatever that thing is. So everything I'm saying is really about recognizing girls as citizens in the broadest sense, making them visible as human beings, and so really not seeing them only as beneficiaries, which is a very important thing, but also as partners, as actors, as decision makers. And they point out how often it is that they are voiceless in family decisions that affect their lives. Their domestic responsibilities exclude them from school and other opportunities, and they don't have access to protection, services, and public resources and spaces that are theirs by rights. They're really invisible. And just to loop back to the description that I began with of the girls in the airport in Addis, you think about how difficult it is for girls to have access to some kind of ID before they turn 18. And here, somebody has found a way of facilitating passports for these girls, and they're going out, by the hundreds every day. So clearly, the capability is there, and there needs to be so much more to make girls, to make them visible and to support their rights as citizens in the kinds of smaller ways that would support their being in their communities. So the first step toward making them visible is by helping to make them audible, to be heard. My remarks today have been based on this publication, Girls Speak, A New Voice in Global Development. It was published by the International Center for Research on Women with the support of the UN Foundation and the Nike Foundation. And I just end with an exhortation that I think our job is to make sure that the world sees girls and listens to girls. And you can call me naive, but I think that once those girls have spoken and people have heard what they have to say, that in many ways there's no going back, that programs have to change, that policymakers have to understand things differently or exist with a kind of internal conflict between what they've seen and then the kinds of decisions that they're making. I truly believe that programs and policies have to respond in a more holistic, ambitious, and rights-oriented way as a consequence of hearing girls' voices. And I know it's not easy, but Excelsior. Thank you.
It's minimized.
Okay, great.
This is not my computer.
All right. My name is Denise Dunning, and it's great to be here with all of you today. I direct a program called the Adolescent Girls Advocacy and Leadership Initiative. And actually, I think that it was coincidence, but the sequence of this panel is perfect because I think Margaret set a really great stage of the challenges facing girls. And I'm going to be talking a bit about some of the context and some of the details that she discussed, as well as really focusing on our program model, how we do what we do, some of the challenges that we've dealt with, and then what the impacts have been over time. So there we go. So just to start off, Margaret covered a bunch of this stuff, but a few of the key points that I wanted to cover. There are 750 million adolescent girls in the world today, and this is by far one of the world's most marginalized and vulnerable demographics. These girls live, a quarter of them live in extreme poverty. 75% of HIV-positive youth in Africa are girls. And that, to me, really stands out because it gives you a sense of both the social, economic, biological, physiological vulnerabilities that girls face for a disease like HIV that, if things were equal, would be affecting girls and boys equally. And at the same time, despite these amazing challenges, only 2 cents on every $1 in international aid funding actually goes to support any type of adolescent girls programming or services. At the same time, I feel like it's really important to focus on the fact that adolescent girls represent a really tremendous opportunity to create change. So from the research, we know that adolescent girls who attend 7 years of school will actually get married 4 years later and have 2.2 fewer children than their uneducated counterparts. So that just gives you a sense of the tremendous return on investment of investing in girls, because these are girls who, if they are educated, have access to livelihoods and jobs that they wouldn't otherwise, who then go on to invest almost 100% of their income in their families and in their future children, as opposed to boys that invest much lower levels in their children. So I really feel like it's important to recognize that this work is so important, not just because of the impact on the individual girl, but also on her existing family and the resources she can bring into the family, as well as her future children, her community, and her country's economic growth. So there's really a tremendous opportunity to create change. So just a little bit about our program. This is a program based out of the Public Health Institute, which is based in California. We also have offices here. We've been around for about 40 years now, running programs both in the U.S. and globally, focused on a broad range of health issues. And the Adolescent Girls Advocacy and Leadership Initiative is supported by a couple foundations. We partner with the UN Foundation, and then we also have support from the West Wind Foundation. We have a couple focus countries that we've started working in since we began this work about 3 years ago. So we're working currently in Liberia, Malawi, Ethiopia, Guatemala, and Honduras. And the question that I always get at the end is, why are you in those sort of random countries? And the reason is because the Adolescent Girls Task Force of the UN, which is a UN body made up of 6 of the key UN institutions, has decided that these are going to be focus countries for them to really try to coordinate their efforts to create change for girls. So at the same time as the UN is really trying to do this work, we are tasked with strengthening the civil society response to help ensure that that UN work is as effective and impactful as it can be. So the goal of our work really is to strengthen the work of in-country leaders who are working on adolescent girls' issues. So we really identify leaders in country who either are working directly in service provision for girls in nonprofits, who are policymakers themselves, who work in media, who work in advocacy, who work in law, who work in a broad range of sectors that have the potential to create change for girls. And these are people who come together, participate in a very intensive capacity building process, and then go on to do their own advocacy work on behalf of girls. So I'll talk more about each of these strategies in a minute. But one of the key points, I think, of our program is that we really focus on a comprehensive model of looking at girls' education, health, human rights, livelihoods, understanding exactly what Meg was saying, that none of this exists in a vacuum. And so if we're not holistically addressing girls' needs and engaging them in a process of figuring out their own solutions, it's not going to be nearly as effective as it could be. So the first piece of the work is a really intensive capacity building week-long workshop. So it's a year-long fellowship that these participants come into. And it starts out with basically 1 week during the first half of which they're really focused on what are the needs and challenges facing girls, and what is the specific institutional and political and legal context of those fellows' particular country. And then from there, they spend the second half of the week doing a very intensive sort of guided coaching process where they identify and develop their own advocacy strategies to address the needs of girls. So looking at the needs in the country and then SWOT analysis, political mapping, sort of what are the steps of the advocacy process, the fellows then look at what are the strengths of their own organization and their own passion with working with girls, and how can they bring those two things together. So it's really, to me, one of the strengths of the program is that, you know, we're not going in and telling people what the solutions look best for their particular country context, but instead what we're doing is finding people who really understand best what the needs of girls are in that particular cultural and legal context, and helping them to develop solutions to improve girls' lives. So when they finish the workshop, after sort of the second half where they've really been focusing on developing these advocacy strategies, they leave the training with a fully fleshed out advocacy strategy and a proposal to solicit funding to implement that work. So during the training, we basically introduce the RFP process to them, where we have competitive funding, where we fund about 25% of the advocacy strategies that are developed. And these are the strategies, again, that, you know, just kind of respond to the unique needs within each country. So we don't go in and say, in Liberia, it's going to be education, in Malawi, it's going to be health. We really look at what the specific unique needs are that the fellows have identified, and then fund the programs that have the greatest potential to create changes in laws, policies, programs, and budgets for girls. We also do pretty intensive technical assistance, both in the proposal development process, because what we find is that often our fellows do tremendous work with girls, but have much less experience of dealing with US-based and European donors and trying to successfully bring in funding to support their work. So we do a lot of technical assistance on helping them to develop really strong proposals so that even those that don't end up getting funded by us have greater success of getting funded somewhere else. So that's one piece of it. And then we also, during the course of the fellows' work, the ones that do receive grants, we do ongoing technical assistance, either ourselves or often hiring local consultants who are experts on the issues. Because often what will happen is they'll develop, say, a media advocacy strategy, and halfway through the year, the government will change. It's a whole new set of players, a whole new set of issues, and they really need to readjust. And so helping them find people that can help them deal with those challenges. So another piece of the work is this ongoing institutional strengthening. So when we're selecting the fellows, we're really looking at who are these change makers in country that can really create new and improved policies for girls. And at the same time, we're looking at what are the key organizations and how can we help strengthen those organizations, both in terms of their capacity, but also their commitment to working on girls' issues. And so after the fellows graduate from the 1-week intensive training, we do ongoing follow-up workshops just about every 6 months that are usually 2 to 3 days on a specific topic that the fellows have identified. So, and I guess one thing that I should mention also is that the whole model is very much about experiential learning. So the fellows, it's all about knowledge acquisition and application and not just kind of standing up there lecturing. So this picture here on the bottom, oh, it's too bad you can't really see it because it's cut off. One of our fellows is right here being interviewed by this journalist. And so this was a training that we did, institutional strengthening workshop we did in March, focused on media advocacy specifically. And the first day was sort of the theoretical, how do you do press releases and press conferences? And then the second day, all of our fellows actually organized their own press conference and had local media come in and do interviews so that they could actually immediately apply what they were learning. And then we also do, these various other topics as well. Another key piece, I think, that relates again to what Meg was saying is really engaging girls directly in this process. So not just working with the people that are already able to create change, but identifying girls and young women who are kind of coming up as they age into positions of potential leadership. So what we found is that our fellows, when they come into the program, are already experts and leaders on these topics. And by the time that they graduate, really are the experts in their countries on advocacy for girls. And so essentially what we do is we pay them to be consultants, to go out and work with groups of girls. Many of them are already working with groups of girls, but for those that don't, to do work with, church groups, school groups, other groups of girls to help girls really learn about their own potential to create change, strengthen their own leadership, to use their voices to advocate for themselves, as well as doing similar types of work with grassroots organizations, because we're really focused on sort of a key segment of the population in terms of civil society, but we also know that there's a tremendous amount of grassroots organizations that are doing great work that don't really know very much about advocacy and how to do it. So we support our fellows to really engage them in a broader movement of advocacy for girls. And then the last piece of the program is actually not something that was originally part of what we had thought about, but we've come to see that there are pretty significant gaps in knowledge about what girls need in terms of advocacy specifically. So one thing that we've done is recently we're producing a movie on child marriage, short film, on child marriage in Malawi, because it's a major issue and people are advocating very strongly for it in Malawi. And at the same time, it's what you see is that it's one thing to have the numbers, it's another thing to hear a girl's own story. And most of the time these policymakers don't ever talk to girls. So, we found one girl in particular through one of our grantees who has this amazing story about how she's been able to avoid child marriage. And we're doing a quick film that our fellows can then use as a tool for their advocacy work. And then this here, we're doing the same in terms of policy briefs. So what we find is that often policymakers don't actually know what the policies are, and advocates certainly don't know what the policies are. And even those who do know what they are don't actually know what most of them say, because they're these long, enormous documents. So basically kind of looking at what are key policies that affect adolescent girls in our focus countries, and then helping to create these policy briefs that put them in layman's terms that are actually a useful resource for our fellows. And we, in most of the countries where we work, English or Spanish might be the majority language, but there are many indigenous languages that people speak much more fluently and read more effectively than they do English. So we translate them into local languages as well. And we found that our fellows actually have been using these tools when they go out and meet with policymakers, and the policymakers actually get really excited because they often don't know what their own policies are. So they're pleased to learn. So this is the program model. It's a bit of an eye chart, so I won't spend a whole lot of time on it. But basically, just in brief, all of the components, the 6 components I just mentioned, are in the squares at the top. And then the specific results that we're working towards and achieving are in the upside-down triangle. And then down at the very bottom there, I'm sure you probably can't see this, but there are copies in the back, if you're interested, are sort of the longer-term outcomes that we're working towards. So Millennium Development Goals 2, 3, and 5 are really key, focusing on big picture, longer-term impacts like governmental transparency, decreased maternal mortality, improved girls' rights and access to education. So the Woodrow Wilson Center specifically asked me to talk about challenges, so I'm going to do that a bit. So obviously there are tremendous laws and policies that disadvantage girls in terms of access to education, inheritance laws. I mean, sort of across the board, there are all kinds of policies that exclude girls from actively participating in their societies and communities. In some countries that we work, there are actually great laws. Most of the countries that we work have signed on to CEDAW, unlike the US, and have actually pretty good national laws. But implementation is a huge problem. And so, people don't know what the laws are, they don't know what the policies are, and implementation basically doesn't exist. So really focusing on that piece is crucial. Social norms, we talked about that quite a bit. So political instability and corruption is a huge problem. This bottom right picture right here on the slide is from the 2009 coup in Honduras, which many of you may remember, where actually we were doing our training 2 days after the coup happened, and so none of our Honduran fellows could leave the country to come to Guatemala to do the training. So, we did all sorts of rearranging, and they actually were able to come a couple days late. But just even that gives you a sense of what these ongoing challenges are in many of the places that we're working. And even in places where there aren't coups like Honduras, in Malawi, for example, the corruption is enormous. And so it's a major challenge. When you're talking about advocacy, you're assuming that there's at least somewhat of a democratic process and that it's possible to change laws and policies through democratic processes. But in some of the countries where we're working, that's questionable. It's possible, but it's not easy. Repressive advocacy laws. So in Ethiopia, for example, there's actually a civil society law that essentially makes advocacy impossible. So any organization that receives more than 10% of its funds from any international source can't engage in advocacy. And that's, obviously a huge problem for trying to support any type of progressive advocacy work on the ground. Persecution of advocates and organizations. I mean, this kind of takes it to the next level even, but is very much a problem. This picture here, the young man in the middle, is actually one of our fellows from Honduras in 2009, who was an LGBT activist, who was really engaged in advocacy for youth and was assassinated by his government after the coup for the work that he was doing. So that's an extreme, but just to give you a sense that these are real, very major problems that people are facing and dealing with on a day-to-day basis. So, there's sort of those horrible examples, but then there's just the also ongoing reality that advocacy is hard. And so these are amazing people who do amazing work, but it's also a burnout job, because every day they're running into walls of all different kinds. And I always remember one of our lead trainers once saying that if you're going to do advocacy, it's not because you either want to be rich or popular. And it's like so true to me because, it's such a challenging work and it's such important work. But I think one of the key things that we try to work on with our fellows is how to do it in a way that's sustainable and safe, both for themselves and their organizations. So widespread violence and poverty. In many of the countries that we're working, obviously Liberia is post-conflict and has all kinds of challenges. Guatemala and Honduras. I think San Pedro Sula was just recently rated the highest rate of murder of any city in the world, including Ciudad Juarez. So, these are major problems that, beyond sort of the political intentional violence, just affect everybody's everyday lives and obviously affect their advocacy work as well. And then limited funding. So obviously none of the governments of these countries are going to give a whole lot of money to advocates who are working to change the government. So it's hard to get government funding. And then there's also a problem in terms of US-based foundations and European foundations, many of whom are super progressive and support really great advocacy work, but the vast majority of whom, focus more on building schools, increasing access to services, sort of more direct service-focused work as opposed to this broader advocacy work. So now that I've depressed you all, I will just talk briefly about some of our achievements and some of the concrete successes that we've had. So we've got 70 folks who graduated from our program since we started 3 years back, who are really just doing amazing work. I'll tell you about some of the specific advocacy strategies in a minute. They form part of this global civil society network that's really engaged and effective in advocating for girls. These fellows have reached over 10,000 girls with their own direct work in terms of leadership development, girls' empowerment, and engaging girls in these advocacy processes. We've had major legal and policy wins, both at national and local levels. And then we've had a couple of new networks that have been formed that I'll talk about in a minute that are really exciting in a couple of the focus countries. So in Latin America, just a couple of highlights in terms of the results. One of our grantees really was focused on teen pregnancy prevention and was able to get 2 national level policies passed focused on this issue. So they created a day for the prevention of teen pregnancy and were really effective in getting a policy passed to increase access to services for girls. Another one of our fellows was working specifically on sexual violence. And so what he was seeing in his organization, which was an organization focused on child abuse, is that when women come into the system after they've been victims of sexual violence, they don't receive very good treatment. And when girls come in, the treatment that they receive is that much worse. And so really what they focused on was developing a national protocol that would ensure that girls receive differentiated and specialized attention and care after they've been victims of violence. So development of protocols to increase birth spacing and reduce maternal mortality. And then really focusing on budgets too. And this last one refers to one of my favorite projects, which is just an organization in the Western Highlands of Guatemala that engages girls in this democratic participation process, starting with girls that are actually as young as 9 and going all the way up to 18. And so helping these girls understand both what the laws and policies are and how they affect these girls, as well as helping girls to really strengthen their own capacity to create change for themselves. So these girls actually formed a youth parliament with boys as well, and actually decided that one of the main problems that they were facing was that they didn't have enough services and programs. So they did this whole budgetary campaign in their region to get the mayors to increase the budgets that they were allocating for girl-friendly programs up by an additional 5%. So that's, to me, really exciting because even if it's at a local level, the fact that girls can really engage as actors, as citizens in these processes to create change just gives you a sense of what the potential is for these girls and young women. So Africa, focus there a little bit. So this one it still kind of blows me away that this actually happened. So there's this children's law in Liberia that had been kind of slowly stankating its way through Congress. And 2 of our grantees applied for funding to work together to actually try to get this children's law passed, which had all kinds of implications for girls' health, education, violence prevention, treatment, sort of across the board. And they were actually able to get it done. And this picture here, again, you can't really see it, but is of President Ellen Sirleaf, who is actually receiving an award from one of the young women who's part of the organization that our grantee runs that was doing all of this advocacy work. So this is, I think, a really critical piece that relates to the implementation. You know, what we see often is that, like I said, laws may be in good shape, but at the same time, implementation is a problem. So one of our fellows in Malawi is actually not affiliated with an organization at all, but is a tribal leader who was really interested in girls' issues and applied to the program. And he is now working to focus on reducing harmful traditional practices in the region of Malawi where he lives. So looking at female genital cutting, as well as many of the other practices that really disadvantage girls and drastically expose them to HIV and all other kinds of problems. Again, more budgetary advocacy focused on sexual and reproductive health for girls in Africa. And then lastly, just other active campaigns that we have going on in terms of violence reduction, early marriage, HIV/AIDS, and a whole other broad range of issues. So the last thing I just wanted to mention is these networks that are being created by our fellows. So what happened here is that in our training back in 2010, our Malawi fellows heard from the Liberians about the fact that they have this adolescent girls working group. And they got really excited about it and wondered, to themselves why they didn't have that in Malawi, and decided to create one. So they basically have created a network of all of the key organizations that are doing advocacy for girls and really thinking about how they can work collaboratively to advocate more effectively for girls' rights and needs. And then we had a similar issue that happened in Honduras where the Honduran organizations worked together with the UN to create a coalition working on sexual and reproductive health to ensure effective implementation of comprehensive sex ed in Honduras. So we've actually made seed grants to both of these networks to really help them get off the ground, and we're excited to see where it's all going to go. So I wish we had more time, but I don't want to steal any of Jen's time. So thank you very much. If there are questions, I'd love to hear them at the end.
So I think, as my colleagues had also said, it's a great now talking about the advocacy, how we've applied the advocacy, and then what I'd like to center in is how PSI, and throughout our work, throughout the world, how we're working with youth, involving them in our activities, and what approach that we take. So I'll go through just a little bit of snapshot in terms of what PSI is doing around the world, and then looking at what process we use through social marketing, our approach there, and our Delta process, and then show a couple of case studies to highlight that. So just as a glance to give people a little context, most of what the work we're doing is focusing on social marketing and social franchising, really working through the private sector but also the public sector as a way to strengthen the health system, working with a variety of partners, both at the ministry level, with other NGOs, at the local and actual people, target population that we're working with. And the main areas we work in are listed above. And I know this is very difficult to see. It's even hard for me up here. But this just gives you an idea of all the different places we're at. And in the back, we had included some of our progress report. I think probably there's not any left, but on our website, you can always find this information about the details. So in terms of that, just in 2011, a couple of our results are really looking at the different countries working on preventing unwanted pregnancies, working on preventing HIV infections, malaria episodes, and then just looking at the type of products and services that we're distributing, working with our partners and local affiliates, and so forth. So now, looking at all the different work that we do, what I wanted to talk about today is our approach to this, and through social marketing and our Delta process of how we're working with youth. So just as a little reminder of social marketing, how we're looking at it is really taking the commercial marketing techniques and applying it to look at which behaviors within the target population we're hoping to influence, and not only for them themselves, but society as well. And, this is something often we hear about products, but it can be applied services as well as specific behaviors that we want to do. So for us, we have a little graph here in terms of our Delta process, and it's just how we're applying social marketing. And it starts in terms of, at first, where are we now? And so for youth, it's really understanding what are the different barriers they have, what risks we're talking about, what knowledge they have, and we'll use primary data, secondary data as well, looking at different things from other partners, what they're working on, and then in terms of youth, what specific things do we know about them? And that really helps us create an archetype of who our target population is, based on, because it's important for us to develop communication and programming activities that are evidence-based so that we can maximize the health impact. And so when we're doing this, we'll come up with an archetype, and then, we want to determine where we're going to go. And then based on that, we'll come up how could we go there. And it could be a myriad of things that we look at. Is it in terms of the types of products we might be offering to the youth target population, the services, where are we offering those services, what type of messages are we providing, who are we involving. And one thing when we work through this Delta process, often it's through a couple of weeks, looking at through a workshop, working with different partners, involving target population people, so bringing in youth, bringing in ministry partners, our local implementing partners, and so forth, so that it's really, we're building on the research that already exists, the knowledge that's out there, and making sure it's tailored appropriately. And so once we understand how we're going to get there, we also need to make sure we have an action plan. Budget is always a big factor in terms of what we can do, but also being able to reevaluate throughout the process. If we developed communication materials or activities around that, we need to make sure that as it progresses, we're actually reaching our target audience, that they're understanding the messages, that we're having the actual impact. And so we can do that through focus groups, research, and talking to the different people and seeing if we do need to adapt throughout a program. So with that said, I wanted to apply that framework to a couple of case studies of where we've been working. So in the first, we have Edgar. He's in our archetype in Guatemala, and we can see on the right there, just gives a little description. This is, we're not going to be able to reach everybody within the target population, but it starts looking at some similarities so that we can understand more about our target group. And so if we look, you have Edgar, who's age 19, living in Guatemala City, loves the technology, radio, and so forth, but also he doesn't have really an outlet where he feels comfortable asking questions about his sexuality, about HIV/AIDS, just family planning in general. And so based on all this data, and this is really boiled down to a very basic level, but it has a lot more information in terms of when we come up with the actual archetype. But then we can look and create a program. And so in Guatemala and Central America, we have a program called Club en Conexión. And it's actually a wide variety of things. We have, for instance, the website, which is one area. We find it's an interactive tool. We can ask questions, get feedback, and that also helps us in terms of seeing what types of people are going to our website, what type of questions they're asking, what clicks they're set pages they're looking at, and so that can help adapt peer education sessions if we have training around peer educators. And then we can also see what effect that's having. And in this program in particular, it started in 2000, it launched in 2010, the website, but we've been doing a lot of different activities. We've already reached 65,000 people through our radio show. And it's a way to look at different touch points. So you have the internet, you have that, you have peer education, you have a radio. So it's really understanding where the youth are getting information like Edgar so that we can be assured that we're having the impact. Another person that we work with is Anastasia, and she lives in Madagascar, and she's 16. As you can see, she's out of school, and one of the things is that she doesn't use any protection even though she's sexually active, but she has friends like her sister who have children, and she realizes she wants to wait, the challenges and so forth, but she's afraid. She doesn't know what type of services. I think often you could see where maybe her mother goes to a particular clinic or her mother's friends, or she doesn't want to be seen asking about that because of cultural norms and so forth. So based on this information and her archetype, we can then think about how can we better service her and provide different services. So based in Madagascar, our program has a program around Top Réseau. And Top Réseau is a social franchise specifically focused towards youth. And I think as some of what Denise and Margaret talked about, having a safe space for youth to go to ask questions, but also to have the providers be trained and understand, the youth don't want to be hearing from the youth talked down to in a condescending way. And so just recognizing that there might be specific needs within the target population, how we can give that message in a place where they feel the youth feel like they can come to. And so part of this is also with the social franchising with Top Roseau. It has a brand name, and as we see, there's 173 clinics. So youth throughout the country know that if they go there, A, it's a place that's safe for them, but that also there's standardized care, there's a certain level of quality, so they can recognize that there's services there that they can access. And then based on that, we can build off that model. We have peer education visits there, you have counseling sessions with IPC. You can also then do outreach work, and then print media or radio can help direct to those people so that they're learning about the different messages, but then they also know where they can go to get services. And as we saw, something that was really exciting in that is that we really saw an increase in contraceptive prevalence in the catchment areas. And, over a few years, 4 years, seeing a 13% increase is quite high. Usually you don't see that in such a short period of time. So it's really just showing the gap in information and knowing where people can access those services, and then having a comprehensive program follow up. So the last person I wanted to talk about was Sarah, and Margaret talked a little bit about the Girl Hub program. So in Rwanda, we're also working with younger girls and boys, in particular in Rwanda, working with young girls aged 10 to 14. And so we have Sarah here, who's 11 years old. She's in school, and she likes being with her friends, and she has her family there, but she's going through puberty, and she doesn't know who to talk to. So based on what we know about Sarah, we have the 12 Plus program, and that's in collaboration with the Ministry of Health, also with funding from the Nike Foundation as part of their Girl Hub program, and also with the Association des Guides du Rwanda, which is basically like the Girl Scouts in some ways. And what it does is it identifies peer leaders, but also matches them with mentors. And so it actually is a great program from as girls age out of it, they can also become mentors, and it links them too, so it develops their leadership skills in terms of planning activities. But these peer leaders, you work through trainings. They are often on Saturdays in safe spaces where girls can come, and they can learn about different things. And we can learn also from them in terms of what are the different barriers that they're having, or what are their different desires. And in this program, one of the things that they talk to is access to assets. So as part of that is talking about financial literacy and tailoring the program to what they need and what barriers they have in their reproductive lives. And something that's really interesting, pre-testing beforehand, their level of knowledge was pretty limited, and they don't know where to go. And then we see through this program that it increases quite drastically. And so I think it is, as part of the Girl Hub program, trying to reach at that level, at age 12 before they enter into sexual activity, so that they're better educated. And I know a lot of the girls speak, and the others talk about the different benefits that they have. So based on that, much quicker, that was just a little snapshot in terms of what we're doing, what process we use to get there, to make sure that we're involving the youth, hearing from them, making sure it's evidence-based, and then also maximizing our impact. And I also brought we have a magazine called Impact, which this last one is focused on youth. There probably was not enough copies, and so it's either you can email me, or it's also on our website for download. But there's a lot more stories like Sarah's and Oscar and Edgar's and others can learn more about. So thank you very much.
Thank you to all our speakers. We are going to have 2 mics around the room, and I thought we could open the floor to discussion now. Well, I actually can get us started, because I had a question that formulated in my mind. Oh, actually, why don't you go ahead first, Meg?
I really appreciated the way the connections between the different presentations, and I wanted, kind of building on the social constructs theme, I wanted to ask you, Jennifer, a question about the distinction between social marketing and lifestyle social marketing. Because I think that the social marketing approach that PSI uses could be even more ambitious than it is. And it seems very oriented toward improving specific health outcomes, which is a worthy thing to do. But some of what we're talking about are much bigger challenges, social challenges and obstacles that girls and boys face. And I wondered if you could say something about the prospects that PSI might take up this kind of more ambitious approach where it's also aiming at changing attitudes or bigger ways that people think about managing their sexuality, relating to others, etc., not only using condoms or kind of specific outcomes.
Is it on? Oh, okay. Not great with technology. No, great question. Actually, when we're doing a lot of our research, what it helps us look at in terms of for not only the individual, but what are some of the social norms or what are some of the barriers. And depending on the different research that we have and we find, we can recognize the bigger issue of social norms and what role we can play. And so there's different advocacy that we could be doing, different communication activities. Obviously, there is a portion that we're focused on health impact, but that's the immediate. And we also, a lot of different programs now are working with different partners to see what types of policies we can be working on, supporting on to help create an enabling environment. And so some of this was done very at the individual level, but I think we're bringing it much broader depending on what the country is, what the context is as well, because it is a very important aspect in designing the program as well. And part of it is also we'd like to involve some of those key stakeholders or players when we're developing these campaigns. So getting some of those policymakers involved so that they understand the situation and educating them as well.
Any other specific questions, or shall I go ahead with mine? This is actually a question to everybody. I certainly understand and appreciate the focus on adolescent girls, and I think, Meg, you gave us good context to why we do need to do that. But I'm wondering, in all your experiences, what you've seen, programs that were targeted towards males, how they may have differed from the ones that were targeted to females. If you could just speak a bit about that. And in particular, do the PSI ads differ, or marketing differ towards boys versus girls? So whoever wants to get us started with that.
I did feel a little bit as though when I explained why I was focusing on girls, I was making excuses. I think it's very important to focus on boys and girls. And part of the reason that I guess I do think that intersection really disadvantages girls, but of course boys are young and their rights and access and so on are limited by virtue of being young. And so they have a lot of difficulties they face. Not only that, but of course they're in the sexual and reproductive health arena, they're directly engaging with girls, and then their adherence to certain social norms is tremendously important. I remember I was working in Turkey a couple of years ago, and a girl who had been a very star student described how her brother, her slightly older brother, who had just was very conservative, had basically lobbied with the parents to take her out of school. So everybody's upholding those harmful norms, and they affect girls and they affect boys and so on. As far as what programs, how programs differ, I do think that the kind of urgency of addressing girls' sexual and reproductive health to avert disaster basically does end up steering programs in a particular way for girls. And I do think that's enormously important, but maybe some of the kinds of things that happen with boys, some of the kinds of programs for boys which are more oriented toward income generation and and so on are of great interest for girls as well. And so I guess it's just that to me, kind of an overemphasis on sexual and reproductive health for girls that concerns me as a difference between the two kinds of programs. I also wanted to mention that when you arrived, this publication was not on the table outside, and now it is, a towering stack of them. So please help yourself.
I think for us, it's really when we're looking at our different programs is understanding the different knowledge, the different risks, the barriers. And so often that's quite different when we look at boys and girls. And so based on that, focusing not only on the archetype, but also looking at different policies that are in place of what we have to work on, the different partners. And I think for us at a very, micro level, let's, for instance, if we're working on a communications campaign, it's maybe through radio, is really looking at the messages, what we're trying to portray, and then thinking, how can we be more gender transformative? And so that really looking at that, so in their different roles and getting them to think, differently. And so I think that's some of the things that we're addressing is definitely will depend on what the evidence shows and the different beliefs and the different thoughts. So.
Yeah, I agree. I think, of course, that working with boys is crucial, both because they have tremendous needs and because we know that you can't work effectively with girls if you exclude boys. So I think that's a really important piece. And at the same time, a lot of the research that's been done on youth programs actually find that the participants are overwhelmingly male and overwhelmingly older. So when we're talking about youth and reaching boys and girls equally, we have to be realistic about the fact that often we're actually not reaching them equally, even when we think we are. So I think that's where AGALI's focus on girls comes from, understanding sort of the double levels that Meg talked about in terms of exclusion and marginalization that girls face. And at the same time, some of our other programs at PHI, we have a youth leadership program focused on sexual and reproductive health that's really focused on youth broadly and having half boys and half girls, young men and women, working together to create changes in their communities. So I think this is one model that serves a very important need, but I certainly wouldn't say it's the only one that's out there.
Here. They're coming with mics.
I guess for the web.
The webcast, it's better to use the mic.
The web. Okay. Thanks so much to all of you for the really interesting presentations. My question is a bit of a follow-up, Denise, for you to what you were just saying. In terms of targeting the young women and girls who participate in the program, could you say a little bit more about how that works and maybe some of the challenges you may encounter in engaging more marginalized and groups of girls, or kind of how that works in the case of AGALI?
Yeah, absolutely. So, our model is really focused on working with people that are serving these most marginalized girls. And so, we're identifying leaders of nonprofits that are working with girls. It really ranges from, slums to rural areas, indigenous communities, tribal communities. So what we essentially do is we rely on our fellows to be able to tell us what the needs are of these most marginalized girls that they're serving. So that's one piece of it. And then in terms of the direct work that we do to really try to engage girls and young women more directly one-on-one, is that while most of our fellows are sort of between the ages of, say, 25 and 50, we actually do really try to bring in younger women who are leaders in their own context and in their own countries as well. So we have a fellow in Guatemala who's 18, a young woman, another in Liberia who's 21, who has her own organization focused on basically peace building and conflict resolution in the context of Liberian problems with the war, and really looking at how those issues impact girls. So it's kind of two levels. It's really, trying to engage young women as much as we can who are already in that position of leadership, as well as much as we can, the part that I mentioned about dissemination and outreach, really supporting our fellows to do the direct work that they really can to engage girls in these advocacy processes, to understand what their rights are, and really advocate for themselves with policymakers to create change.
There's a question behind you, Stuart.
Kind of relating to the question before the last one and to Meg's opening remarks, I think the case is being made very well that we do need to listen and engage adolescent girls, but as many of the presentations point out, access to them is hard. Either they're not in school, or even if you go to the household in the villages, they're out, they're working, and they're busy. Does anybody have any good mechanisms or models on how to access girls so that we can start engaging them and getting ideas from them?
I can talk a little bit about a couple of our grantees, one of whom is an organization in Liberia that has basically safe spaces, safe homes for girls who have been victims of violence, either within their own families or within their own communities, who have, as a result of suffering from the violence that they have left their communities and are now living in these safe homes. And so what this particular organization does is help them have access to education, which they didn't, live in a safe space where they're not victims of ongoing violence, as well as do job training for them. So I think that's one place where you're reaching girls that have already kind of either had to flee or been excluded from their families because of what they've gone through. Another piece that I think is really effective that we see in the Western Highlands of Guatemala is really engaging younger girls. So often, you think of adolescent girls as like sort of the either, 10 to 15, 15 to 19 age ranges. But what we've seen actually is that some of the most effective work, like the democratic participation model that I mentioned that had all this success with budgetary advocacy, engages girls, some of whom are as young as 7. And often the 7-year-olds are the little sisters of the 10-year-olds that are actual participants. But what you see is that when they start out at 7 and they go there for years kind of listening to what their older sisters are talking about, by the time they're 12, they're these amazing young women, leaders and advocates. So really trying to start with even younger girls than we usually think of as typically adolescent.
Yeah, I think for us it's also going back and seeing where are the girls congregating or the boys. Could it be at a well? And is that the best place? How can we bring the messages to them? And so I think understanding what the kind of day in the life of our target population is very helpful, and seeing, because obviously, if girls are in school, you have a center that you can work around. There's challenges as well with that, but also thinking about how do you reach the out-of-school girls and boys, particularly also then in rural areas. And so you could also look at opportunities within technology. We see, for instance, mobile phones being a great way that maybe somebody has access to it they might not own, or do you work towards providing them access to these assets, and then they can call in toll-free to get some information, or call in radio shows and different things like that. So I think it's just really understanding the context within the country you're working with and adapting your activities accordingly.
I was actually telling Jennifer before the panel started that I had a really neat experience a few years ago in India where I got to see PSI's street theater in a slum area, and I think you captured it right there when you said go where people are and into a community in the middle of the day, and street theater busts out in Bollywood song. It brings out crowds in India, let me tell you. So.
Hi, thanks to all of you. They were all really good presentations. And I just had a sort of a thought question, I guess, for the three of you, for anyone, or for whichever of you wants to pick it up. It seems like, things have advanced in the conversation about adolescent girls, obviously, over the last decade or so. And so that's good news that at least there's much more happening in this space, whereas arguably 10 or 15 years ago, there was much less happening and much less success in reaching girls before, as Meg put it, something sort of catastrophic happens to them and they're already off track and they're sort of destined to the same life their older sister or their mother had. So that's great, but it still seems like there's a huge problem with, the other speaker asked a good question. I mean, how do you actually reach more of a critical mass of these girls who are at risk? And so if you could put on or sort of consult your crystal ball, like where do you think we are as a sort of development community in this space? I mean, where are we going to be, like, let's say, concretely in about 10 years? Everybody likes to see results quickly, and, it's not reasonable to think that things are going to change even in 10 years, but could you give a crystal ball prediction on where you think things will be?
And actually, before you answer that, it just struck me that I may have not have mentioned, if you ask a question, please feel free to introduce yourself and your affiliation. So I happen to know that's Kathy Hall with the Summit Foundation there. So. crystal ball?
I don't think anybody wants to pick up the crystal ball. So, well, I mean, I guess I think that we've learned a few things about reaching girls. So combining those two questions, and I think one thing is that we often have to do an intervention before we do the intervention, or we have to do some kind of community level tenderizing or awareness raising in order to be able to help those girls be released to participate in something. So that's one thing, kind of a community education, or sometimes offering something quite specific to girls that families can see will be of benefit, like some kind of exposure or skill building or income generation opportunity, whatever. Seems to be another way to encourage people to let girls go. I was really struck, I'm sorry for being I feel like I'm saying so much about Ethiopia. It's just because I just got back, so my head is stuffed with examples and things that I saw. But one of the programs that I saw that kind of amazed me, and I think it addresses this exact issue, is the Population Council's work with domestic workers. Why should people allow their household slaves to go, and participate in something that competes with Saturday laundry or Sunday floor scrubbing or whatever it is, And I was really impressed. One of the things that they do is they send the mentors or facilitators from the program in pairs to the households to basically introduce the program and to try to make the case that the girl will benefit, and that in the longer term, she will be, that essentially there may be benefits to the household. She will be more aware of hygiene. She will be this, that. So, but you can see it's extremely labor intensive to do that. But it's been very successful, I think quite remarkably successful. And those girls are extremely difficult to reach because their mobility is very high. They don't technically really live anywhere, et cetera, et cetera. But there's been some really interesting work in that area. So I think, just to grab the crystal ball really quickly and then toss it over here, I think that we have learned some really interesting things in this recent period of focusing on girls, and if we really make use of those lessons, we should have gone a lot farther in the next period.
It's a difficult question. I think in 10 years, Michelle Obama might be our first female president. No, I mean, I have no idea. I think at the same time, I guess I would say I'm really optimistic because I do feel like a lot of change has happened. And even just looking at the work that leaders in country are doing with and for girls and the successes that they have had, the example I mentioned of the children's law in Liberia, when we thought about funding that, it was like, well, we have $20,000 that we can give to these organizations, and it's a total shot in the dark, but, we'll hope for the best kind of thing. And that they actually were able to do it gives me tremendous, hope that there is this potential to create change at a much higher level than we think. And seeing kind of how that can affect both sort of this macro level, but also seeing how girls' lives are changing on the ground. So I don't know how to answer your question, but I think that the future hopefully is good.
Yeah, I just think if I look all these different activities, there's definitely more that we can be doing, more funding that we could have to be able to reach more people. But if we think about as we've learned these things, activities have been adapted, you having these girls and boys that are now aging up to older levels, and as they cycle through, they start to become the decision makers. And I think the more that we have that, the more we'll see the process. But I think it's extremely important to keep this at the forefront, understanding that the size of the youth population is, a third of the country's population. So we have to keep on looking at those activities and what impact that they can have. And I think it also helps showing, I like some of the little nuggets of by investing, what's our return on investment if we do it now, and showing them the benefits so that we can also show policymakers, as governments are looking to allocate resources, as donors are looking to allocate resources, what benefit that will help in the long run too.
Question in the middle. I think Janine's had her hand up for a little bit.
Hi, my name's Janine Cosson with Advocates for Youth, and we've talked a lot today about not seeing young people in particular as the beneficiaries of programs, but as partners in the design, the implementation, and evaluation of programs. So I guess my question is really for Denise. Your program sounds fantastic, but it sounds like it's geared towards more adult leaders, and you did mention specifically 2 fellows that were young people, and I'm wondering if you've considered setting aside a percentage of fellows to be among young people, or trying to do more to work with young people who want to create their own NGOs and become those leaders. There are a lot of young people around the world who are doing great work and may not be recognized by the adult population as leaders. And so wondering what you're doing to reach out to that population and build their skills so that they can create their own youth-led organizations. Thanks.
No, you're absolutely right. We have quite a few other fellows that I didn't mention who are also young people and young women. So that's one piece of it. I think another piece of it is that, you're absolutely right. I think we need to be engaging young people as much as we possibly can. This particular model is focused on short-term, immediate change. So identifying people that are in positions that can create change in their organizations and in their governments now, as opposed to sort of a longer-term model. And at the same time, I mentioned another program that we have that's called Go Joven, which is youth leadership in sexual and reproductive health. And that's exactly what you're talking about. So looking, that's 18 to 30-year-olds, young men and women who are really excited about these issues, have less knowledge, have less influence where they are in their current organizations, but many of them are really excited to create their own organizations. So working with them to develop their leadership over the long term so that they can create these changes for other young people, I think is crucial. So I guess, it's a different model. I wish that we could do everything within the AGALI program, but because of the funding that we have and because of the focus and our partnerships with our funders, it's really more about this sort of immediate pressing need to create these changes in policies and budgets and programs. And at the same time, recognizing that if we don't engage young people in creating change for themselves over the long term, then all of it's really for naught. So I think that's a really great point.
Could I just make a very quick follow-up to that? I just think Advocates for Youth is so exceptional in its youth mobilization approach. And I wonder if there isn't an opportunity for advocates to, provide technical assistance to organizations who are interested in doing this more systematically, because it's an effective model, and it's been in place for a long time, but it hasn't been taken up by other organizations. It's a kind of ended up being a specialization of advocates, and I want to figure out a way that you can, take it forward and, into more organizations.
I'm Kathleen Barnett. I'm a consultant in gender and economics, and my perspective leads me to ask a question to all of you, which might be, as the other questioner, more of a thought question. But I kept wondering what your views are in the field of the impact of the changing economic situation on the attempt to change social constructs. It's my sense, having been involved in these fields for a number of years, that a lot of the push for change came when the economies were looking better, at least nominally, and more opportunities through education for girls to work and then bring other income into their families or contribute as a young spouse to a partner's income for the family were high motivations for gender normative change. And Meg also mentioned that in many areas still, the need for girls' household chores is a major factor in limiting a parent or community support. And so the question is for you all to maybe just comment on if you do have underlying economic factors that sustain negative gender norms for girls, changing parents' views or community views may not work. If there's an underlying economic reason that sustains those rules, that's part one. And part two is if the economies are in fact changing for the worse and are on as well, unfortunately, and perhaps affecting donor interest, what do you think that will do to these efforts? I want to also say, as others have said, the presentations were wonderful. It's really inspiring and gives a lot of hope what you are doing and the examples that you give. But I'm just wondering if you'd be willing to go a little outside of the technical areas you're in and just give your perspective on how the economic conditions may or may not shape going forward the ability to change these social constructs in a more gender equitable way.
You know, I think what's interesting is we actually see some of the economies where we're working, actually they have high growth, much higher growth rates. So if you think of Kenya or India, so it's interesting that we have the economy in general, gloom and doom, but there are some economies that are actually starting to really boom in that, and what can we learn from that? And I think, you have to look and see, we have to get better at targeting in terms of if donor funding is becoming tougher, and really thinking what are the different things. You can have a comprehensive program, but what are the different outcomes we're going to have? I think it is a challenge in looking at the different aspects of what we can do with having access to assets is a big thing and a big driver. I think a lot of what we've heard in different documents. And so what can we look towards the, microfinance, looking at the different aspects of that. I don't have a single answer looking at, but it is a challenge, when it comes down to money. So I don't know if my colleagues have other thoughts.
Well, I guess I question the connection between poor economy or weak economy and adherence to traditional social norms, or it's being any more difficult to change those social norms. First, look at Saudi Arabia as an example of where there's plenty of money, but social norms are extremely rigid and contain women very much. And then also, I don't think that economic factors, I think people rationalize gender inequality in economic terms often, but, if the water has to be fetched, why aren't the boys also fetching it? If there isn't a well nearby or whatever the problem is that needs to be addressed, there is an irrationality in unequal gender norms that is actually a great opportunity, because then when people, and everybody's in the norms that guide so many different things that we do, and that's part of the opportunity, that if people can understand what they would like to achieve and how that might impede their ability to achieve the things that they'd like, then there's a strong motivation to change. And then finally, I think that there's maybe in a time of a tight economic time, maybe there's more of an opportunity to make the broader case on changing norms, that it doesn't just, I think we're still working to find the evidence on this, but when you change discriminatory gender norms, you don't only increase condom use or some specific health outcome. If you really, that changing those norms probably has effects in other areas that are unmeasured by the health program. Or in the education sector, it's looking at education outcomes, but it's not looking at the potential other factors. And so, I don't think it's, this really makes a lot of sense to me. I don't think it's an entirely irrational belief on my part that you can really think about gateway as gender as a gateway factor, so that it is opening up to, it's changing a lot of ways that people think about things and do things, so that it may have a number of positive outcomes. And of course, then you can make an efficiency argument that, we've stopped suppressing a large fraction of our population, and now there are all these other good things that are resulting from it. But we tend to measure very much, sector by sector.
I'm Sue Balasubramanian. I manage the Because I Am a Girl initiative at Plan International USA. First, thank you for your presentations. It's really great to have the diversity across the program advocacy and social marketing pillars. So really inspiring and thought-provoking for sure. One of the things that we're working on at Plan is in relation to our girls programming is really making sure that we're reaching the most marginalized girls. And there was a question earlier about how do you find them, how do you access them? And we've been trying to use mobile technology to do community mapping so that, in order to ever impact them or reach them, we have to be able to find them. And, that's been something that's been really successful for us moving, so far in the short term at least. Would love to hear kind of across the three, working directly with girls, Meg and Denise on the advocacy side, and Jen, in the social marketing side, where have you really seen technology been really useful and used successfully in achieving impact?
I can talk briefly. I'm amazed, actually. The cell phone coverage in Guatemala, including in the rural highlands, is higher than it is in the U.S. So there are 113 cell phones in Guatemala for every 100 people. And it's disproportionately, of course, young people that have these cell phones are using these cell phones. And so we've seen that many of the fellows that we have been able to provide funding for their advocacy work, that cell phones are a huge piece of the way that they engage young people, and not just providing them access to information and letting them know where services are, but also to bring people together. So I think that's a really key piece of it. I think another key piece is the social media side. So many of, obviously, the most marginalized girls don't have access to the internet. But at the same time, there are girls who do. And so, having them be able to connect to a more global community and an understanding that there is a whole wide world outside of their small village where they live that are different realities, I think is really crucial to helping them understand what the potential opportunities could be. So those are a couple that I've seen.
No, I think all the stuff that Denise was talking about is definitely ways that we're looking at it. With technology is a big thing, even just looking at TV and radio, which are more of the traditional aspect of it, but trying to make sure it's more interactive and how you get that pull of information as well. And I think the power of the internet definitely is something that we've seen throughout different activities. But as Denise highlighted, you have to think about those that aren't literate and don't have access, and what are those different things we can do. So it's definitely, I think, the way moving forward. I think there was a piece somebody had talked about with mHealth and looking at providing access to phones to women and just at a broader sense, and trying to move that movement as a potential entry point for a lot of different things.
Perhaps Meg, did you want to comment on the technology at all? Or?
No, it's okay. Thank you.
Perhaps then maybe, there's one here, actually.
Sorry, last question. Then everyone.
I was going to squeeze one in.
Oh, really? Okay.
That's what I was going to say. Maybe
Matt Saxton, I work for the Population Council, and thank you, Margaret, for mentioning some of our programs. Appreciate it. My question is more for Denise, and being from the Population Council, one of our big questions is the gathering of data and information, and for obviously dissemination purposes. And I was wondering if you could get to that within the AGALI program, how AGALI is working at gathering that data and that evidence of the advocacy work, and that leads to a lot of this scaling up and showing these best practices. I was wondering if you could just speak about that. Thank you.
Yeah, absolutely. I think I used to work a little bit with the Pop Council, so I greatly appreciate the work that you do and how effectively you integrate the research into the advocacy piece. And I think it's one of the things that we, since we've been doing this now for 3 years, we've built it in since the beginning. And at the same time, we're just getting to the point where we're hoping to do an external evaluation that we can actually say, okay, these are the best practices. These are the actual impacts that we've achieved. So far, I mean, essentially what we do is we track the work that the program has done, the work that the fellows are doing, the actual achievements, of course, in terms of policies and laws, and then the work that the fellows themselves are doing with girls and young women and who they're reaching, how, with what. Because I think that's a really crucial piece because, often there are great numbers out there reaching hundreds and thousands of people, and girls included, but often that's, with a 1-hour chat about how to use a condom. So, I think there are different qualitative levels of reaching girls that are really crucial to focus on, and that's one piece that we've been trying to address, is really helping our fellows through, ongoing trainings like our institutional strengthening workshops on monitoring and evaluation, looking at what the actual needs, both mapping what the needs of girls are and engaging girls in that process to make sure that it's really responding to the actual needs, not just our own assumptions about what those needs are, but also, having the systems in place so that they can effectively understand who they are reaching and who they're not. I think those are a couple of the key pieces that go with it. And then, like I said, we're hoping to do this external evaluation next year that would give us a lot more sort of concrete data that we could share in terms of best practices.
So perhaps there isn't enough time for my question, so I would certainly encourage us all to continue this dialogue. Particularly, I was curious about, you all referenced community buy-in, and I was specifically interested in projects working with faith-based communities and how that plays out in the projects you all represented. So again, probably just need to encourage us to have to continue this conversation, and also wanted to encourage you to visit our website, the woodrowwilson.org/ECSP for Environmental Change and Security Program, as well as our blog, New Security Beat, for more information. And thank you for making this discussion so rich, and please join me in thanking our speakers.